You look at this next study, mold, mycotoxins, and dysregulated immune system. You see here, it's important to mention that mycotoxins are systemically bioavailable irrespective of the route of exposure. Mycotoxin exposure via the airways results in systemic bioavailability. Multiple organs are therefore potentially exposed. Even oral mycotoxin intake resulted in chronic inflammation of the lungs. So take-home point here is, no matter how you're exposed, whether you eat the mold toxins, whether you breathe them, or whether they're absorbing through your skin, once they make it into your body, they go everywhere. They're now systemically bioavailable, and they can damage any organ and any tissue. And this is, again, where the medical community lacks a lot of training on this topic, because they're dismissing mold toxicity. Again, their focus is mold allergy. Our focus today is predominantly mold toxicity. So we look here, one of the largest health threats in the U.S., mold exposure, being a great mimicker of disease, is responsible for the misdiagnosis and mismanaged medical treatment and arguably millions of cases of illnesses. Now, if we look at some of the human research studies, I put this up because it's one of the better research studies on humans. It was a Finnish cohort where they looked at people with directly known exposure to mold, and they looked at the symptoms that these individuals reported when they were being exposed. So you can see here a plethora of mucosal irritation. Mucosa are tissues like the oral cavity, the nasal cavity, the GI tract has a mucosa, the lung has a mucosa, so those are areas where you can get irritation. Neurological symptoms, skin, allergic, and other symptoms, with all family members ultimately developing a multiple chemical syndrome, meaning people were becoming more susceptible to environmental chemical exposures. If you've ever been, at church or in a grocery store and somebody's wearing a heavy perfume and you start reacting severely to that when historically you never have, that's an example of development of chemical sensitivity. You're becoming overreactive to the exposure of chemicals in the environment. Mold-related illness exists in multiple facets, if not simply a transient mucosal irritation or even an increased risk of asthma onset or its exacerbation. We propose a scheme to explain the natural course of mold-related illness. We recommend that future studies should combine data from cancer, autoimmune, and endocrine disorder registers, and neurological and mental health or neuropsychological registers, with mold-exposed individuals being monitored for prolonged follow-up times. In essence, what these researchers are saying is mold can contribute to multiple different types of diseases. Whether it's directly causing them or whether it's exacerbating them is the thing that needs to be studied the most. But the symptoms of mold are multifactorial. Let's look at some of the additional things that we know. If you look here in this study, these doctors were trying to use serum markers or lab markers to identify inflammation in those being exposed to mold. And what they found is that the protein called a serum C3A or complement 3A and C-reactive protein or CRP concentrations were elevated in individuals exposed to moisture damage and microbial growth in indoor environments. These are tests that doctors can run. Generally, they're measurements of systemic inflammation, and what these researchers found is that patients exposed to water-damaged buildings had higher or elevated levels of those chemicals. Now, if you look here, we've got broken down the mold toxicity symptoms into different categories for you, and if you want to pause at a later date, pause the screen, take a screenshot of these slides as we go through them, because there are a lot. But slide number 1 here is respiratory and allergic. So congestion, sneezing, itchy or watery eyes, chronic coughs, hives, sinusitis and bronchitis, excessive mucus production, frequent nosebleeds, worsening of asthma or COPD, recurring sinus infections, and the development of histamine intolerance. Now, these symptoms, these respiratory symptoms, are predominantly allergy-driven. As I mentioned earlier, mold can affect people in 3 major ways: through the allergy response, through the mycotoxin poisoning response driving inflammation, and number 3, through infection. So this first slide is predominantly the symptoms of those in mold developing or having allergic reactions to the molds themselves. Now, if you look at the last symptom on this slide, histamine intolerance is one of the things that drives a lot of the symptoms that you see above it. Histamine is released by immune cells, and largely histamines are responsible for the symptoms of allergic response. But there is another mechanism whereby people being exposed to mold chronically can develop mast cell problems. Mast cells also release histamines. It's kind of a different mechanism. But so if you look here in this research study, they detected mycoestrogens, myco meaning mold-derived. So mycoestrogens were detected in 97% of urine and 84% of placentas in this study. One of the aspects of where we get exposure to this particular type of mycotoxin is through grain consumption. If you're familiar with my book, No Grain, No Pain, one of the concepts in that book that I discuss is the broad contamination of grains by molds and mycotoxins. And this is one route of exposure where we can get exposure to mold is through food. So if you're eating a heavy grain-based diet, it's estimated that between 30 and 70% of the food supply, the grain-based food supply, is contaminated with mold and mycotoxins. So it's one of the reasons why we recommend not eating grain. If you look at this next slide, you can see what happens when you have a mold toxin that mimics estrogen, how it can bind to and change or alter the immune system cells' expression. And so what this is showing you see on the far right of this slide, it's called isotype switching and IgE antibody formation. What's happening when that mold toxin is binding to estrogen receptors, it's just shifting the immune system to make more IgE, and subsequently you get a greater release of histamine into the body, which then drives those symptoms, those respiratory symptoms that we were talking about. But it also drives the symptoms of estrogen dominance. And if you look at this slide, I think it's important to understand, because these are some of the more common symptoms that we see clinically in people who are exposed to environmental molds. If you look here, Zea, aka the estrogen mimicking mold toxin, in women we see menstrual problems, irregular or heavy periods. PMS symptoms can be quite problematic. Breast changes like tenderness and fibrocystic lumps or increased breast density are very common. In men, we see erectile dysfunction, difficulty achieving or maintaining an erection. We see gynecomastia, or the development of breast tissue. We also see fertility issues, and this is both true of men and women. But Zea, or zearalenone, is a tremendous hormone disruptor, and so if we're being exposed to it, it comes with these symptoms. Now, if you look in both men and women, you've got muscle loss and weight gain, you've got mood swings, anxiety, depression and irritability, persistent tiredness and low energy, as well as the potential for insomnia, headaches, as I mentioned earlier, histamine intolerance, bloating, cherry angiomas, and decreased libido. Now, cherry angiomas are a physical symptom. You'll see those popping up on the skin. They look like little bright red freckles. So if you out of nowhere all of a sudden start developing those little red freckles on the skin, that's a cherry angioma. It's very commonly caused by estrogen mimickers. Mold is one of them. Now, other things can mimic estrogen as well, like pesticides and plastics, but mold, particularly Zea, the mold toxin from Fusarium, is a major estrogen mimicker and can create these problems. Now, if you look at this next slide, as I mentioned, mold toxins can elevate histamine by altering your immune system response. If you look at some of these symptoms on this diagram, this just adds to the list, right? So you've got symptoms that I really haven't mentioned, headaches like migraines, dizziness, tachycardia, which is rapid heart rate. Some people develop POTS-like symptoms. You can get pruritus on the skin. You can get flushing and urticaria and dermatitis and swelling in the extremities. You can get bloating and flatulence and fullness after meals, diarrhea, abdominal pain, constipation, nausea, and vomiting. So all those are symptoms of histamine intolerance or elevated histamine exposure. Now, on a side note here, I thought I'd bring this up because many of you may be watching this and say, hey, this sounds like me. A lot of this is what I'm experiencing, and maybe you suspect mold. The number one rule about detoxifying from mold is you first have to get out of the environment. So if you're stuck in a moldy environment and you're trying to get your symptoms to go away, there's not a whole lot that you can do, minus a few things. And this slide represents one of those things that we've seen be somewhat clinically helpful for people, and that's the use of quercetin. And if you look here, the result of this study provides imperative information that supports the use of flavonoids in the inhibition of estrogen receptor alpha to prevent or ameliorate the consequential adverse effects associated with zearalenone exposure. So basically, Zea, the mold toxin, binds to estrogen receptors, ERA receptors, and triggers histamine responses subsequently. Well, quercetin and other bioflavonoids can interfere with that binding, can actually help to negate it. So if you're stuck in mold and you're trying to get out, but you're working on it, maybe there's a financial issue or maybe you just can't get out quite yet, you might just consider the use of quercetin and other bioflavonoids. My favorite combination is quercetin with vitamin C at higher doses to help offset some of these problems as people are trying to navigate their way out of the mold.